Hello, Professor. My name is Derek Duran, and I'm going to be presenting my final project on Chapter 5, which focuses on the Adlerian therapy theory approach. So, to start off, the story of my client. Her name is Julie. She's a 35-year-old unmarried woman, and she kind of has problems with dating men. She struggles with men particularly because of her childhood experiences, like with her father. Her father grew up with her as an alcoholic, and he was very like distant, very emotionally unavailable for her. So she kind of just like grew up feeling guilty about like drinking problems and kind of like believed that it was her fault that she was pushed away from her father. So she just has like a lot of attachment and father issues, which is what her "it's my father's fault that I can't trust men" comes from. She wants to kind of challenge her view and change her fact on men being difficult to talk to, but she kind of remains like shy and timid of that. But she does want to change this, and she wants to um, not blame her father, but that's what she's doing as of right now. Areas of struggle for Julie is that she's starting to feel like negative core beliefs, such as like I'm not good enough or others are better than me, which goes into her faulty interpretations of experiences. So maybe like not dating men correctly or not having like the right man to kind of show her that it's not always that way. And then her low self-esteem too. So her not feeling very confident in her ability to talk to men is what's making her seek therapy. She has behavioral issues too. Her struggles and concerns are that she is kind of like withdrawing from society. Her social activity, she could be a little bit more alone, not really going out to date a lot. And there's a lot of avoidance behavior in that. So trying to kind of pin it or blame it on somebody else rather face it yourself. We see this a lot common in students when they're like procrastinating or they have like lack of motivation. So same similar kind of ballpark that she's in. And then her emotional or social problems that she's facing is her persistent sadness, her anxiety or frustration towards things, and then maybe even feeling inferior to other people. So not really having um, great time connecting, like she's having trouble connecting to others in social settings and situations. Okay, so the maintaining factors I have here, there's a basic philosophy going on for it. There's three things I want to talk about. There's social interests, her lifestyle, and her goals of behavior. The maintaining factors could also be called like the Adlerian perspective. How I look at it as her maintaining conditions is that she's formed these early on life convictions that make um, her current mood and behavior act the way it is. So from early on as a child, growing up with an alcoholic father, being very I neglecting of her, like negligent. She's kind of faced that reality that wow, like men are always going to be this way, or it's my fault that my father is an alcoholic and I can't trust men for that reason. So that early on belief is what makes her feel this way today. She also has issues where she's lacking social interest or connection to people too. And she's very misguided about her like own private logic and mistaken beliefs, which could be a really big emotional struggle. This kind of contributes to feelings of isolation or inferiority. Yeah, those things are not very great for her. And then she's kind of lacking meaningful life goals too, which I think clients can like perceive themselves as like incapable of contributing to society. So she might think that she's not very active in her life right now. Maybe she needs to get involved in more things outside of dating life. But right now, she just feels like she's not worth a whole lot to society. Like whatever she does right now does not maintain or does not pertain to like human advancement, I guess. There's a couple of therapy techniques that I wrote down for her. I wrote down two different versions. The first one would be to assess and interpret, and the second one would be to be encouragement. Encouragement is obviously like the building self-confidence thing, but for assess and interpret, that one is more of like uncovering early memories. Like, so why did this happen to you? Where did it happen? And how can we kind of grow from it? Her patterns and her mistaken beliefs. So whatever she had thought in the past, why or how can we reform that? Let's first learn how we could assess that. um, the mechanism of change that I have for her is her cognitive and emotional. I have that also for the encouragement rationale or encouragement change of mechanisms. I feel like she is very self-aware of her problem and she's like, I need to change who I am, but she doesn't have a very easy time doing it. But she is open to change. So I think that her cognitive and emotional part of her does want to change it, but socially she might need to get the drive out there. So that's what I have for assessment number two, which would be to encourage her. I feel like this would help build her character, her self-confidence, make her feel more boosted and make her feel more proud of who she is. Um, I think that it's hard when you're 35 years old looking to still date and not to marry. Um, because I feel like people have their life figured out by that time where they want to, oh, I have steady income or I have things going on with myself that are like I have kids or I'm also divorced or things like that. She is unmarried. She's not divorced. Um, but a lot of people in that age range, 35 and up for dating, might feel like it's really difficult to be more confident of who they are. I feel like really early on when they're like in the college setting where they're all drinking and everything, they can all kind of just be in that culture. But right now it's more of like I have things to provide for my family. I have things to provide for life. What do you have? So encouraging her getting back out in the field and seeing what she can do with that. That would foster her hope, resilience, and her belonging to the world. Now, for her assessment, I did the SMART goal to the left side. For her SMART goal, I could think of like her specific interactions with people could be like engaging in social activities. Maybe, and I have her as a picture right here. Join like a local community group, such as like a book club or volunteering for like a library or something. The way I can see it as like measurable is she can go to at least one meeting per 4 weeks or one one group meeting every week for 4 weeks. I feel like that would help her kind of wean into her healing process, but it wouldn't like kind of just push her there every single day, forcing her to go to therapy. It's more of like a let's talk about this with a group setting. The way I can see her SMART goal being achievable is that Julie would express interest in reading and she'd have access to like local library stuff and she could host group events. Maybe she can be with like a group of girls, like do a little like book club or like wine and dine thing. Um, I think that's like a really cool thing for people that age. How I see it being relevant to Julie is that it would target her lack of social connection. So it would kind of make her depressive symptoms a little bit more alleviated in a sense. She wouldn't be very closed off and isolated from her first initial story. She'd be a little bit more having friends, having a better connection, contributing to society too. And she could meet guys. Time bound, I can see this being something for, like I mentioned in the measurable part, for about 4 weeks. And then we're going to follow up with her doing an SII assessment. SII is the Social Interest Index, which is pretty much like essential for understanding and treating like presenting problems with students or with people in her age. This tool can help evaluate the student's level of social interest, community engagement, and sense of belonging, which gives her insight into how much she feels connected to people. So I think that that would be a great help for her. The whole purpose of the SMART goal I have here is that it would kind of like encourage behavior activation in her like social meaning of life. Um, and this kind of supports the Adlerian therapy approach because it aims to increase social interests, but it's also like in um, a way that's challenging her isolation-based beliefs. So back when she had been dealing with problems with her father, not dating people, I feel like this could be a really good alternative to her approach, not just getting her out there and like speed dating people from Hinge or from Tinder. I think it's one of those things where she can just meet people on the fly, have no strings attached to it, where there's no kind of relationships involved, just meeting people. And then from that point, she can build a better understanding of who she is socially. I feel like that also allows her to track her progress and creates like small achievable goals or like steps outside of her dating role too. I'm going to be comparing the Adlerian therapy approach to CBT, cognitive behavioral therapy. I did this one when I did my group presentation for group nine. I feel like it still is very like prevalent in how we can compare and contrast theories now. The similarities that I found between CBT and Adlerian approach were that they both emphasize in presenting functioning and change, and they also help clients identify and change maladaptive thought patterns. Where this might differ, however, is that the Adlerian therapy approach focuses on social connection and it also focuses on a purpose and early life influences, whereas CBT is more structured around like thought distortion and symptom relief through skills training. So a lot of things could be done early on for their life in Adlerian, but CBT focuses on like the now of it. So it doesn't really do like oh, tell me where it all started. It's more of like how can we get you through this now? Let's talk about it now. Maybe we can dig out old things, old patterns, but let's focus on the now and the future. But Adlerian is like more of like, how did it all begin? Um, I think a few pitfalls of the entire approach in general is that it kind of overlooks a client's need of meaning. So like CBT won't really give like a lot of backstory as to how it first originated. It would be one of those, okay, like that doesn't matter to me. How can we help you now kind of thing. And I feel like my people might want to talk a little bit more about that. So it doesn't really serve like the long-term purpose. It also doesn't focus on the holistic development thing, kind of like the Adlerian therapy approaches on. But it more so focuses on like symptom reduction. Adlerian therapy, although it may differ, like deeper insight as to how we can change our personality and how we can motivate ourselves. Um, I think that is like especially helpful for clients who deal with like chronic like isolation or depression. I don't think CBT could really do a whole lot of that. CBT is more like evidence-based theory stuff. They're effective for like symptom reduction, and it may be like contemplated, sorry, complemented. Sorry, I have speaker notes. Complemented by approaches addressing deeper existential problems like that. So. I think there's different themes of CBT versus Adlerian therapy. Adlerian would be the one that would be most appropriate in her case, but she could also do CBT. A lot of people do. I think it's the most common one. For my evidence-based treatment, I found a couple of examples. Actually, these three pictures on the left are from the YouTube channel from Dr. Todd Grande. I pulled a couple of his videos because I just like to watch them about how he talks to older clients, and they all refer to it. I think we've watched one or two of these before in a class thing too. Um, so how I see it is that for other clients, their use of lifestyle has like really shown improvement emotionally, according to Carlson, Watson, Minacci. There was also a study with like 30 divorced women. This is unrelated. This was like 30 divorced women who had gone to Adlerian therapy. They had gone in six different group sessions, like maybe like once a week for like 6 weeks. And they actually experienced and they had reported back that they were having more like increasingly like significant improvements in their quality of life. That one is cool. I have that on my resources or on my references page. So kind of like the change in symptoms of the patients could be like their increased self-efficiency, reduced social withdrawal. They have greater mood, better goal orientation, and kind of like a better overall life satisfaction too for that. Um, Here's my references. I referenced the book. I referenced the Carlson, Watson, and Monachi approach, the video I was talking about. I've also referenced Taba. Dr. Taba, she was doing something for the 30 divorced women. It was part of her study. And then that's the DOI for it, as well as the book. And then I just wanted to end off by saying thank you, Professor, for having such a great class. I didn't want to report it to you in person or online, but here I am now. I think you did such a great job improving my social interaction too. I never really had a problem speaking to students in class, but a lot of them are more socially driven towards like homework and study groups, but ours is more discussion based. Everyone kind of talked in there. I don't know if you noticed, but everyone did kind of become a friend in there. And I don't know everybody's name in every class, but that's one of the few intimate classes, 3386 that we had, that I feel like I knew everybody in there. I knew what they had to offer. So I really thank you for that. And I hope that in the next semester or so, we can also talk about how great of a class you had. I want to take you for more classes, and I do recommend you to my students who or to my friends who want to take you. So maybe you'll see a couple of people recommended by me. But yeah, thank you for that. Hope you have a great summer. And that's it. Bye bye.